Hello, mortals. I am Dr. Sombrio, and today we're going to uncover one of the cruelest whims of human genetics. Imagine an 8-year-old child who looks like an 80-year-old, with gray hair falling out, wrinkled skin, and clogged arteries like an old man. In 2014, a girl named Sammy Basso shocked the world by becoming the oldest person with this condition at age 28, looking like she was over 150. What causes this temporal nightmare? Progeria, also known as Hutchinson-Gilford Syndrome, the disease that literally steals decades of your life in just a few years. Progeria is not caused by viruses or bacteria, but by something even more sinister, a microscopic genetic mutation that acts as a time accelerator within your cells. The culprit is the LMNA gene, responsible for producing a protein called lumin A, which functions as the internal skeleton of the cell nucleus. When mutated, it produces a defective protein called progerin. Think of it as a cellular poison that accumulates progressively, causing every cell in the body to age rapidly and uncontrollably. But how exactly does this malignant protein destroy the body from within? Progerin accumulates in the nuclear membrane like toxic rust, deforming the cell nucleus until it becomes unstable and dysfunctional. This causes three devastating effects. First, DNA becomes more susceptible to damage, accelerating the natural aging process. Second, cells lose their ability to divide normally, causing tissue atrophy. Third, telomeres, the biological clocks of cells, shorten dramatically, as if someone had pressed a fast-forward button on life. The symptoms of progeria are a gallery of horrors of accelerated aging. In the first weeks of life, babies appear normal, but at 6 months the macabre signs begin. Extremely slow growth, progressive loss of hair and body hair, thin, translucent skin with visible veins, small face with receding chin and beaked nose. At 2 years of age, they develop severe joint stiffness, loss of subcutaneous fat, leaving them looking like living skeletons, and most frighteningly, advanced arteriosclerosis, i.e., arteries of a child with the age of a centenarian. The progression is relentless and predictable, like a death clock. Between the ages of 3 and 8, serious cardiovascular problems arise. Severe osteoporosis that makes bones as fragile as glass, progressive hearing loss, and respiratory complications. The immune system remains curiously normal, but the heart ages 8 times faster than normal. Most do not reach the age of 15, with an average life expectancy of only 13 years. They usually die of heart attacks or strokes, diseases typical of the elderly, but in the bodies of children. Now the question that plagues medicine: is there a cure for this temporal curse? Unfortunately not, but there is dim hope on the horizon. Scientists have discovered that drugs called farnesyltransferase inhibitors can reduce progerin production, offering some relief. Experimental therapies include antioxidants to combat cellular stress, statins to protect the heart, and even genetic editing with CRISPR, attempting to rewrite the defective code of life. The numbers behind this genetic tragedy are disturbing. Only 1 in 20 million births, about 400 known cases worldwide, aging 8 times faster than normal, and 90% of cases are spontaneous mutations, meaning it can happen to any family. The scariest part? Studying progeria is helping scientists understand normal aging, revealing that we all carry small amounts of progerin as we age naturally. Remember, mortals, time is the most relentless predator of existence, and progeria shows us how life can be cruelly shortened by a microscopic error in the code of life. These children teach us that every day is precious. Every moment is a gift that should not be wasted. If this video has made you reflect on the fragility of existence, leave a like to feed the darkness of the algorithm. And if you want to unravel more dark mysteries of medicine, subscribe to the channel and activate the bell of mortality. Until the next consultation, may time be generous to you. Translated.